Hello everyone, today we're going to discuss about the ankle sprain injury. Basically, ankle sprain is in which the tendon which upholds the ankle are either extended post their cutoff range to the point or torn inside and out. In this, the facts that mostly occurs in the basketball players or the football players or due to sudden twist or turn while they are playing or they are running. And basically the mechanism of injuries, in this injury the tibio-fibulous syndesmosis ligaments involves the dorsiflexion or eversion of the ankle with internal rotation of the tibia. And the anatomy of the ankle joint is basically it is composed of three bones. Like if you see from the upper side or the anterior view, the tibia which forms the inside or the medial part of the ankle, and that after that comes the fibula which forms the lateral or the outside part of the ankle, and then the underneath the bone includes the talus. And the basic signs and symptoms of this injury are especially when you bear weight on the foot, like injured foot, there's a pain and tenderness when you touch the ankle, swelling and bruising, and there is a restriction in the range of motion and instability in the ankle as well. And while during the injury, there is some popping sensation like sound is made during the injury as well. The sound you hear during the injury. Okay, so now we are going to discuss about the injury management. The basic first step we are going to use to analyze the severity of the injury. So the basic care is acute care, in which we start the first aid right away during the time of injury, like whether it's on the field or off the field, and which we analyze the severity of injury. And if it helps to reduce the swelling and pain, and we also use the RICE method, like for rest the ankle and put ice on it. And after that, we'll ask specific questions to the client or the patient so that we can analyze the severity of the injury, like how is your ankle and where is the exact location of the pain, and was there any popping sound during the time of injury, and do you have any pain while moving or while putting weight on your feet. Also, and we'll also ask them to move their toes so that we can get to know is there any further injury in their toes or the on the foot. And so how to diagnose the severity of injury? First, we'll observe the ankle from the top view, side view, so that we can get to know where the exact injury occurs, and we can also suggest for the X-ray as well, so that is there any fracture during the injury. So in diagnosis, we can diagnose by physical examination of the ankle. First, the basic thing is the swelling, redness, pain, tenderness, and the range of motion, like the movement of the ankle. Is the client can make the movement or not. Okay, so now is the last step is the treatment and restoration of the normal range of motion. So now in this, once the swelling of the ankle is reduced down and the pain is also reduced, we resume the movement and we will give a series of exercises so that the ankle will for the flexibility and strengthening the motion we can use this range of motion with the assisting slow and steady, so that it helps to gain flexibility and strengthening of the muscle. Okay. And once the balance and the stability is reduced of the restored of the joint, we can also use other exercises like slow walking of the ankle, movement round movement, slow and steady, so that it doesn't damage. And after that, after this, slow walking, brisk walking day to day, and after it almost take 2 months to restore the full joint and muscle strength and flexibility. After that, after physician diagnose each and everything, the sports person can go on field after the injury is restored and healed. Thank you.